healing mechanism through collagen formation, angiogenesis, as well as the bone formation. So coming to the history, we all know the Chokran et al. Is the first person who introduced the platelet-rich fibrin. Before that, the regenerative potential of platelets was introduced in 1970, and the clinical application began in the field of medicine in 1987 in an open heart surgery by M. Ferrari. Whitman et al. Introduced the PRF, means PRP. The previous version of PRF is platelet-rich plasma in dentistry in the year 1997. So after that, due to the various disadvantages, the PRF, that is platelet-rich fibrin, was developed in France by Chokran et al. In 2001. Coming to the classification, so by Dohan and Renfest et al. In 2009, it was classified into pure platelet-rich plasma and leukocyte PRP, and pure PRF and leukocyte PRF. So what is the meaning of PRP and PRF is, PRP is platelet-rich plasma, means it will be in the liquid state while we are injecting it into the specific site. That is, for example, if there is any wound or if any regeneration is required, we have to inject the plasma in it. So due to the various disadvantages of plasma, they started preparing the fibrin, that is PRF. It is the next generation agent, which is a gel form, which is easy for the placement of the platelet concentrate. So the classification is platelet-rich plasma, which includes pure and leukocyte, as well as PRF, which includes pure and leukocyte. Coming to the next classification, based on the generation, it was classified into first, second, and third generation. First generation was pure PRP and leukocyte PRP. Second generation was pure PRF and leukocyte PRF. And third generation was the advancements, that is APRF, that is advanced PRF, TPRF, that is titanium-based PRF, and IPRF, that is injectable PRF. About the PRP and PRF, I will be explaining in detail later. So growth factors are the prime role for the usage of PRF. So why those growth factors are important and what are the growth factors which it include? See, first it is epidermal growth factor. The function is it regulates the cell proliferation and differentiation. Insulin-like growth factor, which helps in cell metabolism and growth, and it helps in osteoblast formation. The more the number of osteoblasts and more bone formation will be there. So platelet-derived growth factor, that is PDGF, it causes mitogen of connective tissue cells and various cells which will enhance the collagen formation. Then TGF, that is transforming growth factor alpha and beta, they regulate the cell proliferation, differentiation, and apoptosis of the induction of initial thickening. Means the thickness of the wound closure will be more because of the platelet concentrates. Then vascular endothelial growth factor will regulate the angiogenesis. So all these growth factors will help in collagen tissue formation, angiogenesis, and the osteoblast, means the bone formation as a whole. So coming to the first generation platelet concentrates, those are platelet plasma. So what do you mean by platelet-rich plasma? Which is of liquid state. So once the whole blood is obtained, that what we do is we will centrifuge the blood. So it is obtained from the autologous blood. It is a platelet-rich fraction of plasma, which help in normal healing process by delivering the growth factors. In this, it contains 95% of platelets, 4% of RBCs, and 1% of WBCs. How is this prepared? It is prepared by, see, first we have to collect the blood from the patient. So around 8 ml, for example, here it is given 34, it is around approximately 8 ml of blood will be collected and it will be centrifuged first and the second spin. In the first spin, we'll centrifuge it for 10 minutes for 2,400 rotation per minute, in which the RBCs will be separated by the plasma. And in the second spin, we will use for 15 minutes of 3,600 rotation per minute, in which the platelet-rich plasma will be separated from the rest of the blood, that is platelet-poor plasma. See, for example, it can be well understood in this. First, we'll collect the whole blood from the patient, for example, 8 ml, and then we'll centrifuge it in a centrifugation machine. So in the first spin, here it is given the different name. We use usually the 2400 rotation per minute for 10 minutes. And then in that, we will separate the RBCs from the fluid. Then again, we will use the centrifugation for 3600 rotation per minute. We'll increase the speed for 15 minutes. There we will separate the PRPs, that is platelet-rich plasma, from the platelet-poor plasma, means the rest of the blood. Now we have obtained the PRPs which can be injected to the required site. For example, if there is any destruction of the bone, or if there is any bone augmentation, any procedures, we can fill this liquid, and we can see the wound closure and the progression and regeneration. So coming to the application of PRPs, these PRPs can be used in treatment of various structures. Not only in dentistry, it is used whole systemically for treatment of shoulder injuries, elbow problems, back and hip injuries, wrist and hand problems, knee injuries, and ankle and foot also. And especially it can also be used for hair transplantation also. But coming to the periodontics, it can enhance the regeneration. This is one of the study which was conducted where there was a bone destruction, and after usage of PRPs, we can note there is a maximum amount of bone fill in this patient. So this was one of the great example for the usage of PRP, that is platelet-rich plasma. And a study done by Yilmaz et al. In 2009, in his study, they used PRP, that is platelet-rich plasma, and bovine bone matrix. In that study, again, the treatment with combination effect was significantly favorable in clinical and radiographic improvement compared to the use of only the other growth factors and the bone grafts compared to the PRP. So there was a positive result of usage of PRPs in Elma study. And one more study by Leukovic et al. In 2003, in his study, they used the PRP, that is platelet-rich plasma, BBM, that is bovine bone matrix, and GTR, guided tissue regeneration membrane. All these three was used in combination as a regenerative treatment for furcation defects, that is grade 2 furcation defects in humans. This is an in vivo study. In humans it was done, and the result showed that experimental group in the sense, the group in which the PRP was injected presented significantly greater pocket depth reduction compared to the other group. So a systematic review by Del Fabro et al. Can you guys mute your this thing? I can hear my voice again. Okay, thank you. So Del Fabro et al., in his systematic review, he has come across various studies where there is a mixed opinion or the mixed result for the studies, because one study have proven that PRP is more beneficial, whereas various other studies have shown that there is no improvement on application of PRPs. So there are various studies to list here. And finally, the Pradeep et al. And Bharadwaj et al. In their study, they have shown there is a strong improvement by the placement of study PRPs, whereas the Harnack et al. And Roderick et al. In their study, they have shown no improvement in the usage of PRPs, and the results were similar compared to both experimental as well as the control group. So what are the merits and demerits? So coming to the merits of PRPs, it is an autologous preparation. It is free from any transmissible diseases. It is convenient for the patient. And the last one is, it is the rapid regeneration. So it helps in progression and the rapid regeneration of platelets and the growth factors to that site, and acts as a fibrin glue. The most important demerit of the usage of PRPs are the use of bovine thrombin. Bovine thrombin, the usage, what is the disadvantage is it can develop antibodies to the clotting factors, and it can be life-threatening for the patient. And the second one is, it is liquid form which cannot be filled in the areas properly. And the third one is lack of uniformity in the PRP preparation protocol, because different platelet concentrate at different times. So we need different time to concentrate the different type of platelets. So that is why the second generation platelet concentrates were developed that is called platelet-rich fibrin, which this is most important one, which we are all using in our clinics. So it is autologous leukocyte and PRF biomaterial with a specific composition and three-dimensional architecture with incorporation of almost all the platelets and more than half of the leukocytes along with the growth factors as well as the stem cells. So in a test tube, when we prepare the PRF, it will be visualized like this. That is, the lowest part will have the RBCs collection, that is red corpuscles, and in between there is a gel form of fibrin clot which can be easily removed by using the tissue forceps and placed in the required site. And the upper layer will be a acellular plasma which has to be discarded. So this is very easy. And how to prepare the PRF? See, once we collect the blood from the patient, so it is chairside treatment, 10 ml of, for example, 10 ml of sample will be collected from the patient, and this is transferred to the test tube, and this on centrifugation at 3000 rotation per minute for 10 minutes will obtain the PRF. So at 3000 rotation per minute for 10 minutes, there will be a 3 layers which will be formed. One upper layer will be poor plasma. There will be no platelet. So platelet poor plasma will be there. And the middle part will have the PRF and the lower part will have the red corpuscles, that is RBCs. Here we can easily remove the PRF by using that will be like a gel form. Easily we can remove and we can place it in a sterile metal cup and then we can place it in the required site. So this is very easy and very quick procedure which can be done. So coming to the properties of PRF, it contains intimate assembly of cytokines, glycanic chains, structural glycoproteins which are enmeshed between the slowly polymerized fibrin matrix or the network. Second, it considered as an immune node which stimulates the defense mechanism, because once it is placed, there are various growth factors which will attract or recruit the different immune cells to the particular site. So there will be a faster response to the formation of the new whatever tissue or bone, and everything will be faster in rate. Then significant inflammatory response at the surgical site after PRF placement due to the cytokines which are enmeshed within the matrix. So as I said, cytokines will be recruited to the particular sites. So what are the merits of the use of PRF? First important thing is there is no use of bovine thrombin or anticoagulants in preparation of the PRF. Second, it is convenient for the patient as well as it is easy handling. Third, here only the single centrifuge cycle requires, whereas in PRP, as I described, we wanted to do two centrifugation cycles, whereas here it is very easy, 3000 rotation for 10 minutes, our PRF is done. So it is single cycle. Then it even acts as a vehicle for tissue engineering. The demerit is it should be used very immediately, or else there is a chances of shrinkage of PRF. And the second one is if it is refrigerated, then the chances of bacterial contamination is more. So we have to look into these two things and then use the PRF. So how the growth factors help? Mainly, as I told before, it will upregulate the collagen synthesis in extracellular matrix and provide a scaffold for the cellular migration and adhesion. Mainly, one important thing is first, as PRP does, it will give more of growth factors to the particular site, as well as since it is a gel form, it acts as a scaffold for the regeneration process. Coming to the application of PRF, so PRF can be used in different sectors of dentistry. In endodontics, mainly it is used for regeneration of pulp dentin complex and also in the treatment of open apex. And in combination with MTA, it can be used to create an end barriers in apexification procedures in order to prevent the extrusion of the materials. And in regenerative pulpotomy also this can be done, and to fill the bony defect, we can use the PRF. So mainly it is used for regeneration. Extraction sockets, if we have to preserve the socket, then we can use PRF as a filling material or to fill any bony defects. And bone augmentation in the sinus lift procedures during the implant placement for the maxillary arch. So this can be used as a bone augmented material. And for ridge preservation in older patients or in the younger patients where, for example, if there is any trauma or excision or any resection of the mandibulectomy, we can do for the ridge augmentation as well as preservation of the ridge. PRF can be used. And for guided bone regeneration, and it can also be used in tissue engineering for in vitro cultivation of human periosteal cells of bone. Coming to the periodontics, which I will be explaining in detail. So the uses of PRF is mainly it is used in the treatment of infrabony defects. See, for example, suprabony defects are very easy to treat. Infrabony defect, there will be loss of too much of bone. So we have to regenerate the area. So for that, there are various studies and various materials which have been used, but the usage of PRF along with those materials have shown the proven results and better results in the various studies. Then it can be used in furcation involvement. I'll be showing one case which we have done in our department in the furcation area, and a beautiful result have been come. And in ridge augmentation, sinus perforation repair, gingival recession cases, we can use PRF. Papilla reconstruction can be done using PRF. Socket preservation, as I told, in oral surgery, and it enhances the healing at the palatal wound after the free gingival grafting. In recession, while we can when we harvest the palatal graft, we can place the PRF in that region also to heal the area faster. So one of the case we have done numerous cases, and one of the best cases in the furcation area where there was a deep pockets and the bone loss. We had placed bone graft along with the PRF in the region, and you can see the preoperative and 3 months post-operative picture, how beautifully there is a bone fill in that region. So we are about to publish this. So usage of bone graft along with the PRF in a furcation area, and the beautiful results have been obtained. So when we cannot do any improvement easily, we can place the PRF along with bone grafts or any usage of GTR membrane to obtain a good result. So how to activate this PRF? How does it activate? So contact with the dry glass tube is necessary to start the polymerization process. So the centrifugation process I'm explaining. Then the silica ions which are present on the surface of the glass tube behave as a clot factor by active as a factor 12, that is Hagemann factor. So to produce PRF, either the dry glass tubes or the glass coated plastic tubes can be used. So a study by Sai et al., it showed that PRF upregulated the proliferation of PDL cells. Then PRF promotes the phosphorylation of ERK in human osteoblasts and PDF cells, which results in upregulation of osteoprotein and alkaline phosphatase and helps in bone formation. And a study by Lekovic et al., he has done studies both on PRP and PRF. In his study, he combined PRF with bone material, and the result of this study showed that improved clinical parameters were associated with infrabony defects. As you see, there is a gain in the clinical attachment of 3.82 mm, which is very great. So PRF has the ability to augment the effects of BPBM, that is bovine bone material, in reduced pockets, which improve the clinical attachment levels. And the meta-analysis, coming to this meta-analysis by Shah et al. On PRF, in his meta-analysis study, he compared various studies, and all the studies have shown the proven result and the positive results, whereas in PRPs, we had some negative results and we have neutral results. But in PRF, all the studies have shown the improved results. So this can be one of the, for example, a guiding path for us to use PRF in a daily basis. Coming to the advances in PRF. So after PRF, a concept, as I said, the third generation is advanced PRF. That is, there are 3 advances: IPRF, APRF, and TPRF. Along with that, there is one more new concept, that is CGF, that is a concentrated growth factors, which was introduced in 2006 by Sacco. A special centrifuge called Medifuge is used to prepare the CGF, which is similar to the PRF. but with a different centrifugation speed, which allows the separation of a fibrin matrix, which is much denser, larger, and richer in the growth factors. So in a study, it has been shown to have a greater versatility and better regenerative capacity for alveolar ridge and sinus augmentation compared to the PRF. So concentrated growth factor, which is an advanced version of PRF, is shown the proven results that it is far better than the PRP and PRF. So other advancement of the PRF is titanium prepared PRF. So what is this? Here, instead of, as I explained, in a glass tube, there will be silica, which has the adverse effect on the body. So to replace that, they have started using the titanium tubes. So titanium tubes are used to prepare the PRF in titanium prepared PRF. So this is one of the advancement which was done by Mustafa et al. He studied this PRF using titanium tubes for centrifugation, and which is similar to the LPRF, but only the titanium tubes are used instead of the silica tubes or the glass tubes. Here, with the use of titanium tubes, they have noted that the PRF which was obtained was more tightly woven and thicker compared to the other PRF. So thicker the PRF, more beneficial to the body or the required site for treatment. Then the next one is advanced PRF, that is APRF. APRF means they wanted to do the bone formation. So in normal leukocyte PRF and all, there was collagen formation, there was angiogenesis and all. They wanted to incorporate the release of BMPs, that is bone morphogenic proteins. So they started using the monocytes along with the PRF. So that is called advanced PRF. The platelet-rich fibrin was developed 15 years ago, is now updated to advanced PRF in an attempt to incorporate the monocytes within the PRF. This was introduced by Chokran, who is known as the father of PRF or the platelet concentrates. They have discovered with the using of soft tissue growth and various bone formation or ridge augmentation everywhere. In APRF, there will be a release of more BMPs into the area, and the sooner or the faster recovery of the tissue. So again, this is further classified into plus APRF and APRF minus or minus APRF. The only difference is based on the duration of the centrifugation. In advanced PRF, APRF plus, there will be a reduce in the time for centrifugation, that is only 8 minutes, 3000 rotations per cycle will be used, whereas in APRF minus for 12 minutes, 3000 rotations are used. That is the only difference. Here they have reduced the duration of time of centrifugation. So advanced PRF, incorporation of the monocytes was used, and plus and minus is the further discovery where the duration of the time was reduced. And the last advancement of the PRF is IPRF, which is injectable PRF. Here, the PRF is slightly liquidous in nature, which can be injected as a fluid into the particular site. So that is why it is termed as IPRF. IPRF is the PRF which clots after injection. Once it is injected into the, using the syringe, we have to inject it. And once it is injected, it becomes a clot. So the aim of IPRF, it is to improve the biotype of the gingiva. See, for example, if there is any recession or any other gingival cut, we can inject this IPRF so that it accommodates according to the adjacent shape of the gingiva. So to improve the biotype of gingiva as well as to enhance the matrices with the growth factors, IPRF has been discovered. So Mora et al. In 2015, he described the technique to obtain an injectable form of PRF, which is called as IPRF. In this technique, a short centrifuge of 2 meter at 3300 rotation per minute gave an orange color fluid which can be injected or mixed with the bone graft to give the agglutinated stick for the bone grafting. Means everything is same, but in usually PRF will be of gel form, and here it will be like injectable, that is in a syringe. The liquid form of PRF will be injected. So coming to the end, we all know PRFs, that is platelet-rich fibrin, can be regarded as the dense fibrin biomaterial with biomechanical properties. A dense fibrin clot can serve as a biological healing matrix which supports the cell migration and cytokine release. So the PRF and the plasma in this scenario or in this world have emerged as a powerful therapeutic tool for the management of soft as well as hard tissue healing and for regenerative procedures. So this minimal invasive cost-effective technique will raise the bar of clinical dentistry, which is practiced at the present. So usage of this PRF in a daily basis, I think it gives an excellent result. We all can use it. The only thing is we have to, make the institution to buy the centrifuge machine, and then we can keep it in the department and use it. So thank you for giving me an opportunity to present this lecture, and especially my regards to Dr. Aparna, who have been coordinating with me since a week. Thank you so much. Thank you, everyone.
Thank you so much, Dr. Kavishri. It was a very beautiful presentation. I like the way how you started from the basics and then you took us through the clinical cases and actually proved it to us how PRF and other platelet-rich concentrates are so crucial and they give such beautiful results. The way you showed us that the bone fill actually happened clinically, that was really, really beautiful. And I think many of the clinical practitioners will actually be encouraged after seeing your webinar to use more of these platelet-rich concentrates like PRF in their own practices. That's going to give wonderful results. And you actually showed it to us right now. Thank you so much, Dr. Kavishri. So we'll take up some questions. Before that, we'll just see about our company. So this is this platform is provided by DentistChannel.Online, and sorry. Yes. So we provide several services for dental professionals as well as dental organizations. We have dental news, webinars, courses, events, videos, clinical IT activities, Prime membership, and you can submit articles to us. Dental businesses contribute videos, buy and sell. And for organizations as well, we have several opportunities, as you can see. And the key highlights is that we provide more than 700 plus live dental webinars and more than 25 plus dental workshops. There are, as you can see, so many participants attend this and they all get participation certificates. There are various national and international esteemed speakers with us and more than 300 plus oral care videos under the Save the Two. So also we have been shown we have been entered into India Book of Records for maximum speakers participating in virtual dental program on oral implantology. And we also provide Prime in DentistChannel.Online. You can access all our webinars and there'll be special discounts on dental courses, certification with CPD CD points, regular updates about the dentistry and several other benefits. We'll also provide CPD, CD, and CE points for all webinars and courses. And now you can join us for just $7.99 per year, which is equivalent to $10 USD. And you can get a special discount by using the promo code AP100. So these are our upcoming webinars. And now it's time to take up some questions. So Dr. Kavishri, as you have told, it was such a beautiful presentation. I cannot help but tell it again. Thank you so much for your time also. I have a query. I think you're muted. So how long can we store PRF once we extract it? How long can we store it? Should we immediately use it or we can keep it?
As I said, it is better to use immediately or within 10 minutes because if you store for a longer time, then it shrinks. Once it shrinks, it will lose its structural integrity and it won't adapt to the area and the growth factors release will be very less. So better to use it within 10 minutes of extraction.
Yes. Thank you so much. I had this query in my mind. Thank you so much. Thank you so much for your time. It's been a wonderful seminar and we all enjoyed it a lot.
Thank you so much.